Hi, folks. I'm Mike Dasher. I'm chair of the Chatham County Board of Commissioners, and I've been hearing from a lot of you with some really good questions about COVID vaccines here in Chatham County. So I am delighted to get to sit down today with Chatham County's Director of Public Health, Mike Zelek, and talk about all things COVID vaccine related. So Mike, thank you very much for your time. I know you are a busy guy these days.
Commissioner Dasher, thank you so much for speaking with me. We really appreciate the opportunity to answer some of the questions that you're getting and that the Chatham community has. So thank you for taking the time to be here.
Sure. So we're at the Chatham County Agriculture and Conference Center, and we are socially distanced. I should mention we're here in separate rooms, but you guys have been regularly transforming this place into quite the public health operation. So why don't you tell us a little bit about what you're doing here and the process and how many folks you've been able to serve and all that good stuff?
Absolutely. The Chatham County Agricultural and Conference Center has been a tremendous resource for us as a public health department and the Chatham community. We're so grateful to the staff here for allowing us to use this facility and the parking lot to host mass vaccination clinics to get our community vaccinated against COVID-19. So we have to date hosted 3 mass vaccination clinics at the Ag Center here in Pittsburgh for a total of over 1,000 first doses of COVID-19 vaccine. This is a tremendous effort from our team, our volunteers, the Community Emergency Response Team, CERT, Emergency Management, Sheriff's Office, the Ag Center staff, our staff, community volunteers as well. Truly a team effort, as so much of the COVID pandemic response has been to date. Vaccinations are no different. So we're just grateful for to all of the folks who have made this possible. So speaking about these mass vaccination clinics alone here at the Ag Center, we're talking over 1,000 people to date. To date, for Chatham County Public Health Department, we have administered over 1,500 first doses of COVID-19 vaccine as well. And that includes our clinic and some targeted events at places like congregate living facilities and independent living facilities. So lots of work going on from the health department, and we're just one of the providers, and I'll mention, we'll get into that later, but it's a community response, and there are many folks that are involved in that response.
Yeah. So let's kind of start at the beginning. How do folks get registered with Chatham County for a vaccine?
Absolutely. So there are many options to be vaccinated for COVID-19. We all have the same limitation, which is that the demand among those who are eligible to receive the vaccine currently far exceeds the supply. It's an issue that all providers are running into right now. So if you go to chathamnc.org/coronavirus vaccine, you can see a list of providers in and around Chatham County to get the vaccine. So that's a good starting place. You can also get added to our contact database for the Chatham County Public Health Department. On that webpage, we have a tool where you can enter your information, which is also available at chathamnc.org/vaccine tool. You'll go through, you'll put in your information, your contact information, and it'll match you up with the eligibility group that you fall under. So currently we're vaccinating, as you know, healthcare workers with in-person patient interaction, as well as residents and staff of long-term care, and then those who are age 65 and older. So those are the current folks who are eligible. You can put your information in that tool and be added to our contact list. You can also call our info line, 919-545-8323. It'll be open and live beginning next week, Monday through Thursday from 10 a.m. to 4 p.m. We'll have live people responding. Now we're getting a huge volume of calls right now, so we ask and are grateful for everyone for their patience.
Sure. So are only folks who are eligible right now, the 65 and older, able to register, or can I register in advance of that phase opening?
Sure. You could go on now and fill out the form. It will link you to the appropriate group. So, for example, frontline essential workers, group 3, you can go through, it'll link you to that group. You can go ahead and put in your information. You're not eligible yet, but when the time comes, we have your contact information. And what we also do with folks on that list is share information about other vaccine providers as well.
So what are the current numbers right now in terms of folks, eligible who are are waiting. And I know that can be a little misleading because you're working with different partners and people are getting vaccines, not necessarily through Chatham County.
Yeah, absolutely. So if you look at groups 1 and 2, again, the healthcare workers, your long-term care residents and staff, and your adults 65 and older in Chatham County, we're talking about 20,000 people, over 20,000 people eligible. To date, among Chatham residents, a little over 10,000 Chatham residents have received their first dose of COVID vaccine. I mentioned that we've administered as a health department about 1,500 doses. So you can see what volume we're doing and what supply we're getting relative to the overall picture. We know folks are listening to our advice to reach out to providers, whether they be in Chatham County or surrounding areas, to get the vaccine. So that's the number who are eligible, the number who have gotten it. And then on our contact list, we've had about 15,000 individuals who are eligible be added to that list. Now, some have already gotten the vaccine, but you can kind of do the math on, we're getting a couple hundred doses each week as a health department. We have thousands of folks who are still eager to get the vaccine. And we know that it takes time. We know that it can be frustrating to wait and to wonder when it'll be available to them. And we're grateful to them for their patience as we continue to work to vaccinate and to link folks to other providers as well.
Yeah. Well, that's great. I mean, 10,000 is, that's what, 12, 13% of Chatham County's population, which seems a whole lot higher than some of the national figures that I'm seeing. So
I looked at it the other day. Actually, News and Observer has a kind of vaccinations per 10,000, and Chatham is ranking in one of the top, I think, 8 or so counties in terms of the proportion of the population that has been vaccinated to date. Again, that's not just the public health department, that's other providers in Chatham County. And we know a number of folks are getting the vaccine in nearby counties as well, from bigger options like UNC Health, Duke, VA, things like that. So yeah, it's good progress. Here we are about a month in, a little over a month in, about 10,000 or just over 10,000 Chatham residents have been vaccinated. So that's good progress, but it also paints a picture of how far we have to go in this journey. We're going to get through it, but it's just going to take time.
Mm-hmm. So if I go to the Chatham NC website and you said it'll tell me other providers that where I can sign up or register to get the vaccine, what are some of the other places in Chatham County that are available?
So the providers in Chatham County that are currently vaccinating against COVID, in addition to the Chatham County Public Health Department, UNC Health at Chatham Hospital is one, Piedmont Health Services is the other. So those are the 3 providers who have been allocated a COVID vaccine to date. We expect more to be coming on board in the coming weeks and months, but it's going to depend on sign up among those providers, as well as, of course, the allocations from the state and the federal level. Yeah,
so let's talk a little bit about that. I know you mentioned a couple of times this is a supply and demand imbalance here. So how does that process work? Does Chatham County makes a request of the state requests from the federal government? How does that all get hashed out?
So each week, Thursday night, Friday morning, we receive an email, we being any provider in North Carolina of COVID vaccines, we receive an email with our allocations for the next week. So we know we hear from folks saying, I'd really like to plan ahead. We would as well, but one of the challenges, we get such short notice in terms of our allocation. So Thursday night, Friday morning, we get an email that says, here's how many doses of vaccine you'll get the next week. So like last week, we found out we would get 200 in a base allocation. This is a new approach the state did this week. We know now that we will get 200 doses each week for the next 3 weeks through a base allocation. So the state had a little bit more heads up from the federal level, a guarantee of a certain number of doses, and then they can tell us 200 doses each week for the next 3 weeks. That's the most advanced notice we've had to date. And then there's also the state carves out an allocation for an equity allocation, basically to reach different populations, historically marginalized populations. So for example, we made a request on top of our base allocation last week for another 200 doses, working with a predominantly African-American faith community in rural Southwest Chatham County. They gave us that additional allocation specifically for that event. And we've been working with that faith community to schedule appointments, and then also pulling from our database, folks who have signed up from our database who live in that kind of greater area in Chatham County who may have access issues to some of our other events to fill up the schedule for Friday's event. So that is a new approach this week with the base allocations and the equity allocations, but typically Thursday night, Friday morning, we learn what we're getting the next Tuesday, Wednesday. We use that within the week, and then the next week we do it again. So the state says, you need to use your doses within that week. And that's where we are right now. We use up our doses within that week, and then we see what we get the next week. But we do have capacity as a public health department. I know other providers have greater capacity than the supply that they're getting. That's just the reality of what's coming from the manufacturers to the state and then to the local level.
Yeah. So 200 last week. And I know you guys had a big event here last Monday. Is that right?
Last Monday, correct.
And got over 200 folks vaccinated. We'll get another 200 then this coming up week. And it looks like, baseline 200 for the next couple of weeks anyways.
That's correct. So this past Monday, we had that 200 allocation. We did 200 vaccines. Well, we had a few more. So we did just over 200 vaccinations that day. The previous 2 Mondays, we had a little bit more. So we were able to schedule 400. But with that 200 base allocations, with our kind of core event being Monday at the Ag Center, depending on allocations, we schedule the appointments. So right now it's looking at around 200 appointments, depending on what allocation we get.
Okay. And how many folks could you be serving? I know the first event you had here at the Ag Center, you did quite a few in a single day, right?
The largest one we've had to date was just over 400. We can do more than that. And as we start getting the second doses, we anticipate that we will be, because we'll have the 400 second dose appointments, again, 4 weeks after the first dose was administered. So not this coming Monday, but the following, we will have our first second dose appointments in the Ag Center, 400 appointments there, plus whatever first doses we receive. So we'll likely have 600. So we're talking about the logistics behind that. If you've been to it, people are getting in and out in around 30 minutes. That includes a 15-minute monitoring time. That's something we're proud of, really a testament to our team, our volunteers, our staff for making that possible. I know you've probably seen other places where the lines can be quite long, and we certainly don't want our residents to have to wait in those types of lines to get vaccinated. So in addition to giving them the vaccine, we do it with a smile. We try to make it as efficient and pleasant as possible. And so that's just part of the process. But certainly we'll be looking, as allocations allow, to increase the throughput there and potentially serve more folks. So we've done 400. We can do more than that. I don't think we've hit our limit yet, but we'll kind of, it'll depend on allocations really is our limiting factor right now. So
as far as some things folks have been maybe hearing about on the news, let's talk a little bit about some future plans. I had heard this week that the federal government is now going to start distributing to pharmacies. It looked like on a pretty small scale. Can we expect that in Chatham County anytime soon?
That's a great question, and I think something we're all really interested in, the pharmacies and other providers coming on board as well. I've seen the news at the federal level. What I haven't yet seen is what that means for the local level. So hopefully as we see the allocations coming out in the next couple of weeks, we will start to see what that looks like locally. But we certainly want people to have access to it. It's not to me so much about who puts the shot in the arm, it's that folks are getting vaccinated. So it doesn't have to be the public health department. Again, we don't have the allocations or the capacity to vaccinate everyone. That's what those partnerships really are about. And so we'll be looking to see how those federal announcements kind of filter down at the local level.
Sure. I've also heard from some residents in other kind of groups that aren't necessarily eligible for vaccines as far as the guidance goes from the state, but first responders, teachers, of course, that are real anxious to get those. How does that work? What guidelines is Chatham County following? I know some counties you're hearing are vaccinating teachers. I don't think we're to that point yet, but what guidelines do you follow, and when do you see those opening up to additional groups?
Sure. So firefighters, first responders, teachers, childcare workers, meat processing plant workers, all those folks fall under Group 3. They're prioritized as frontline essential workers. That is the next group that's eligible. We know that we still have thousands of eligible individuals in Groups 1 and 2 that we continue to work with the other providers in Chatham County to vaccinate. We are required as providers, but the health department as a provider, other providers are required to follow the state prioritization criteria. And currently, the eligible groups are Groups 1 and 2. And so that's where we are right now. I don't have a clear timeline as to when we will get to Group 3. I know many are anxious to get there. We have a lot of folks who are interested and already on our contact list. We've been working with these employers to get these folks identified and onto our list so that we can link them either to vaccines from us or to other providers when the time comes. It's just so hard with the vaccine to know exactly what the timeline looks like because we don't have a clear view as to what the allocations look like.
Sure. Well, Mike, I really appreciate your time today. I know you're busy, and really thanks for taking the time to talk with me and to answer some of these questions for our residents. And thank you to you and all your staff for all the work that you guys are doing. We're all very grateful to have you on the front lines dealing with this and helping our residents navigate the process. So thank you.
Well, thank you, Commissioner Dasher, so much for not only your time, but your support and the support of the full Board of Commissioners. You all have been very grateful to us as a public health department. You've asked wonderful questions and connected us to resources and information in the community and are a key piece of us sharing information with the residents of Chatham County. So we really appreciate your support, your guidance, and your leadership in these efforts. We're early in this vaccination process. Everybody will get a vaccine who wants a vaccine. The state has been clear about that. It's just going to take time. So we can't answer the time question, but we know that vaccine production will hopefully ramp up in the coming weeks and months ahead. We have additional vaccines that are up for emergency use authorization, and we'll be doing everything we can as a public health department and Chatham community to get the folks who are interested in the vaccine vaccinated. And that's a tremendous development for us as folks who have been on the front lines fighting this pandemic for the better part of a year now. This is a really exciting development. It is hard work, it is long hours, but at the end of the day, we have really a solution and a potential to get beyond this pandemic in the vaccine. And instead of putting out fires, we can really get ahead of it. And so we're working hard to do it. Holding vaccination events is tremendously rewarding for me as a public health director. And I'm so grateful to our staff who has just worked so hard, but also to you all, the Board of Commissioners, for your leadership and support as well.
Well, thanks, Mike. We'll talk again soon.
Absolutely. Anytime you want, I'm happy to talk with you.
All right. Thanks.
All right. Take care.